Now I request the next speaker, Dr. Sailaja, to talk about newer drugs in glaucoma.
So, good morning everyone, I am Dr. Sailaja. So, actually my presentation is a bit lengthy, but I will try to cut short and skip few of the slides. So, why is there a need for newer drugs when we have so many drugs already in glaucoma? Can I have a pointer, please? Pointer. So, the medication that are available at present, they focus mainly on increasing the uveoscleral outflow and decreasing the aqueous production. But 80% of the outflow, which is the trabecular meshwork outflow, is yet unanswered. So, the newer drugs target mainly on the trabecular meshwork outflow. So, these are few of the newer drugs which help in ocular hypotensive, stem cell therapy, neuroprotection and gene therapy. So, they can be divided in those things. So, newer ocular hypotensive agents are the ROCK inhibitors, alpha-1 receptor agonists, nitric oxide donors and cannabinoids. So, these are the Rho and Rho kinase inhibitors. These belong to the Rho family and they phosphorylate many downstream target proteins. So, the mechanism of action is that at the end they increase the aqueous humor outflow resistance, decrease the aqueous outflow resistance. So, role in decreasing the aqueous humor outflow resistance is by the increase the number of Schlemm's canal and endothelial pores and hence decrease the focal adhesions between the Schlemm's canal cells and the juxtacanalicular tissue and relaxes the smooth muscle cells in the trabecular meshwork. This in turn increases the blood flow to the optic nerve. Other actions are like they increase blood flow to the optic nerve head, promote ganglion cell regeneration and regulate the scar tissue. Excuse me, sorry. It's okay, ma'am. Thank you. Sorry for that. So, the ROCK inhibitors that are available in market present are the netosudil and the ripasudil. So, Reiki is no financial interest. So, Reiki is the netosudil eye drops. It's applied once daily. So, additional advantages of this is that they decrease the aqueous humor production and also supplied in combination with the latanoprost in the trade name of Rocklatan. So, these are few of the studies which I am not going into details. So, what they does is like when applied on the cornea, in the presence of corneal esterase, it gets converted into nesartudil M. And this is the ripasudil, it's available as 0.4%, it is a derivative of fasudil. The regimen is twice daily. So, additive lowering, IOP lowering effect of ripasudil with the timolol and latanoprost has been noticed. These are few of the side effects of the ROCK inhibitors like conjunctival congestion, subconjunctival hemorrhage and corneal verticillata, and all these adverse effects reverse after cessation of the medications. So, these are the drug trials which I am not going into details. These are the adenosine A1 receptor agonists. So, they are located, the receptors are located on the trabecular meshwork and the ciliary body. In the trabecular meshwork, they upregulate and increases the outflow facility, and in the ciliary body, upregulation causes reduced aqueous production and decreasing the intraocular pressure. This is again the mechanism of action. So, BCKA channel modulators are the nitric oxide donors. So, dysregulation, normally the nitric oxide synthase is decreased in the trabecular meshwork, Schlemm's canal and ciliary muscle in patients with POHE. So, dysregulation of nitric oxide generation contribute to the elevation of intraocular pressure. So, what they does is these donors, they provide nitric oxide which causes trabecular meshwork and the Schlemm's canal cell membrane hyperpolarization, as you can see here. Hyperpolarization, decreased calcium influx, they inhibit the actin and myosin interaction and relaxation of the trabecular meshwork and the Schlemm's canal and increased outflow facility. So, nitric oxide donors approved are the nipradilol and latanoprostine bunode. So, this is the nipradilol is the twice daily dosing. Latanoprostine bunode, when applied, it gets so on application to the eye, in presence of corneal esterase, it gets divided into latanoprostic acid and butanediol. So latanoprostic acid acts similar to the latanoprost, increases the US scleral outflow, whereas butanediol monotitrate, it gives active metabolite nitric oxide. This is the nitric oxide donor. These are few of the studies. So nitric oxide, it is both a neuroprotective and a neurodegenerative agent. So coming to cannabinoids. So despite extensive research, the role of cannabinoids in medical management still remains limited. So I'm not going into detail. These are few of the neuroocular hypertensive medication under evaluation. So steroid antagonists, siRNAs, we call it as S-Silk, lateralclinic acid and the K-ATP activators. So still I'm not going into details of these things. So neuroprotection, the process of glaucomatous cell death always is due to apoptosis. So blocking the apoptosis increases the cell survival. So causes of, these are few of the causes of, retinal ganglion cell death. We call it as, small mnemonic as skin. So one is the induction of superoxide, K is induction of kinases, I is increased intracellular calcium, N is neurotrophin deprivation and E is excitotoxicity. So these are few of the methods of neuroprotection, pharmacological, again we can give a mnemonic as PIPs, pharmacological, immune modulation, preconditioning and stem cells. So pharmacological, we have the memantine, glutamate receptor antagonist called memantine. This prevents calcium influx in the retinal ganglion cell and subsequent apoptosis. So brimonidine, it causes upregulation of the anti-apoptotic factors and inhibition of nitric oxide synthase. These are few of the neurotrophins like brain-derived neurotrophin, ciliary neurotrophin factor and the growth-derived like nerve growth factor. They are still in the trials. So immune modulation is one of the newer techniques still under trials. Focal activation of the immune system in the optic nerve or the retina. This activates the T lymphocytes primed to the optic nerve and constitutes and releases the neuroprotective factors. So preconditioning. What is preconditioning? So preconditioning is causing a sublethal injury which subsequently protects the more severe glaucomatous damage. See here we are preconditioning it with a sublethal injury and tolerance is attained here, and when there is a severe injury it gives neuroprotection. So the major trials that are going on now are the stem cells. They can be used for repopulating the retinal neurons that are lost in the glaucoma. So stem cells are mainly extracted from the hair, bone marrow, adipose tissue and the dental pulp. These are the mesenchymal stem cells, as you can see here. So they are neuroprotection, retinal activation and produce the all GDNF, BDNF and CTNF which helps in neuroprotection. So gene therapy, this is the latest thing that is aquaporin and brain derived neurotropic factors have been being tried now. In a nutshell, these medications, the newer medications, they help in increasing the trabecular meshwork outflow, the uveoscleral outflow and the aqueous humor production. These are a few slides on the drug delivery systems. So the common complaint of difficulty in instilling the drops and difficulty in adhering the eye drops administration schedules. These are the common complaints that the patient gives us. To erase the chronic medication use, new sustained delivery drug delivery systems have been developed. So one of them is the Ocusert. This was first sustained pilocarpine implant that is introduced in 1975, but this was soon taken off because of the poor medication tolerability. Next is the bimetoprost implant, also called Durista. This is a sustained release biodegradable implant that uses the Novadur drug. This is the drug delivery system that has been used, the Novadur drug delivery. The implant is administered into the anterior chamber using a 28 gauge single use pre-filled applicator. The drug delivery system is made of the biodegradable polymers which disintegrate by hydrolysis into carbon dioxide and water. These are few of the trials of the Durista. So main concern with this delivery system was the drop in the corneal endothelial cell density, which was greater than 20% at 20 months and 20.8% respectively after 10 and 15 microgram groups when divided into these two groups. This is the bimetoprost ring. So this is a polypropylene ring that is impregnated with bimetoprost. It continuously elutes bimetoprost for a period of 6 months, after which it needs to be replaced. But the rate of drug elution decreases over a period of time. That is the main drawback of this ring. So contact lenses, these are use of missile-laden contact lenses for delivery of the glaucoma medications. Advantages are the patient familiarity and long hours of use. Travoplast punctal plugs. So they are inserted into the upper or the lower punctum. The delivery of travoplast was over 90 days. Sir, almost done. Almost done.
Please stick to the time, no?
Yes, sir. Done, sir. At last, this is the latest one, which is nanotechnology. The medications are piggybacked onto various nanoparticles, which bypass the biological barriers, rendering the drug delivery directly to the target sites. And these are the nanoparticles. Thank you.